My name is Tina Cifuentes, and I am doing a speech for my speech course in college. These are my people. 1, 2, 3, 4, 5, and 6. Today I'm doing a speech on autoimmune diseases and disorders. The main ones that we will be talking about are lupus, rheumatoid arthritis, and Crohn's disease. Other would be multiple sclerosis, psoriasis, and narcolepsy are other forms of autoimmune diseases. Now, according to the Mayo Clinic, 30 million adults and children suffer from diabetes. Type 1 diabetes is an autoimmune disease where our body destroys the cells in the pancreas that produce insulin. Autoimmune disease can be very complex and hard to understand. All of us have a body that has an immune system. Our immune system is there to fight off disease, infection, whether it's bacterial or viral. With autoimmune disease and disorders, the body doesn't recognize our own tissue as being ours, and so it attacks it. First, we're going to talk about rheumatoid arthritis. Now, I've passed out some flyers like this. Osteoarthritis is a normal wear and tear of arthritis in one's body. Now, with the rheumatoid arthritis, the synovial membrane that protects and lubricates joints, it becomes inflamed, like here. And it can cause joint erosion. It comes with horrible swelling and pain. And according to the Mayo Clinic, rheumatoid arthritis attacks the lining of the joint. It then inflames the cells, releasing enzymes that eat away at the bone and the cartilage, and it causes crippling bones and horrible pain. Now, with Crohn's disease, our body attacks itself again in the immune system, but it is more directed toward our stomach. My gastroenterologist has this fantastic diagram on the wall, and I think it just kind of explains everything to a pretty good degree. The pain is different from person to person, but I love this where in the stomach it will show us how, like piranhas, vicious fishes, ever vigilant, and when aggravated, they gnaw relentlessly at anything that is within reach. Here's a little humor for you on the stampede in our intestines. Without a moment's notice, the herd launches into a frenzy, and all thought is obliterated and replaced with a singular consuming need for a prolonged visit to the nearest porcelain lounge. And this vice in the small intestine, once its teeth are dug in, it refuses to let up. The fangs stab and squeeze tightly without remorse, sometimes for hours on end. The last one I'd like to hit in depth is lupus. Lupus is an autoimmune disease that it isn't just the joints or it isn't just the stomach. It can attack a person anywhere in their body. It could be the liver, could be the heart, could be the lungs, could be the skin. Here is a diagram that shows you the impact of lupus on one's body. It attacks a central and peripheral nervous system, causing seizures. Hearts, lungs, kidneys, blood, you can have anemia. Eyes, mucous membranes, ulcers in the eyes even, gastrointestinal, musculoskeletal, and the skin. Now, lupus is another autoimmune disease where it attacks, but so scientists are not sure, but they believe that people that get lupus and other autoimmune disease are dispositioned. And the other things could be triggers from life's happenings. Let's talk about some treatments for autoimmune disease. Could you imagine being told you have a disease and the words right after that is, but there is no cure? There is no cure, but we can treat it. And it's tough because to treat it, they have to kill our immune system. And Humira is an example. Azathioprine, which is generic to Imuran, are some of the main ways that they kill our immune system. But once our immune system is killed, then we are very susceptible to other viruses and bacteria and getting sick. And we have to be really careful. Prednisone. Prednisone is a steroid, which is the best anti-inflammatory that we can get that will help when there's a flare-up. If there's an attack where it's attacking really bad, and if we take a dose of prednisone for a tapered amount of time, it will lower the inflammation and decreasing in the pain. Diet. Diet is very important. Certain foods you need to stay away from, and water. As with any kind of diet, drinking plenty of water is very helpful. They do not know what causes autoimmune diseases or disorders. It just happens. And are there any questions?
Is there a certain sex that lupus tends to occur in more?
You know, as a matter of fact, there is. So 90% of people with lupus are women. And 80% of them develop between the ages of 15 and 45. Thank you. Any other questions?
You said something about flare-ups. What about flare-ups?
So flare-ups happen usually the triggers in life, which could be sunlight. For lupus is a huge trigger. And then stress. Stress is a main factor that can cause a flare-up. And so if you can keep your stressors low, it will benefit you from some of the pain that you endure with these diseases and these disorders.
And you mentioned diet. Is there a certain diet you should be on, or is it?
There probably is a certain diet. I don't know what it is.
Okay.
Do you know?
No.
No. No. I know foods that are, you know, I don't know. I just know that it's important.
Yeah.
Yep. Okay, so we talked about autoimmune diseases today, and the main ones we hit were rheumatoid arthritis, Crohn's disease, and lupus. We hope you have a little better understanding of how the body attacks itself. Thank you.